hour of 11 a.m. having arrived, the House will come to order. Members, please take your seats. Sergeants at arms, please close the doors of the House. Prayer this morning will be offered by our colleague, Representative Young. Immediately after prayer, we will recite the Pledge of Allegiance. Members and guests, please rise as able.
Lord, thank you for another opportunity to come before you to say thank you. Thank you for the breath of life. Thank you for the trees that blow. Thank you for the birds that fly. Thank you for our health, our strength. And Lord, thank you for the wisdom that you give us and provide to us daily as we ask for it. We pray that you guide our hearts and our hands to continue to do the best we can while serving your people. Those of us who understand that we are not here for ourselves, but here to serve. Give us the strength and the guidance and the wisdom we need to govern accordingly. Those of us who are still unsure of our place and our purpose and our inability to look beyond ourselves and our selfish needs, help us find another direction and another space so that the Commonwealth and the people who dwell within can have hope, and they can have purpose, and they can be a part of something greater than themselves because they see us as people who are willing to fight for the benefit of serving and fight for the benefit of seeing people thrive in their various spaces. We pray that you continue to hold us dear to your hearts as we make mistakes as human beings, but also guide our hands and open us up so that we can be united as one as we realize that we are here for our future. We're here for those children who are not yet able to stand in these spaces, but we need to give them hope. For our seniors who live such a great life, we pray that you help them see that their lives are not in vain and that we are still in the progress of moving in a positive direction. So with all these things, I pray in your name, amen.
Amen. I pledge allegiance. Sergeants at arms, open the doors of the House. Members and guests, please take your seats. Without objection, the approval of the journal from Tuesday, June 4, 2023 will be postponed until printed. Colleagues, please take your seats. We have about half of our guests here. If you could just take your seats so we can acknowledge our guests that are in the gallery. Colleagues, please take your seats. Please take your seats. We can acknowledge our guests when you take your seats. Our colleague that serves Lycoming and Union County, Representative Flick, has some very important guests that are joining us on the floor of the House today. We're so excited that seated up in the gallery, we have the leaders and the scouts from Boy Scout Troop 600 in West Milton. They're visiting the Capitol today, and they're preparing to celebrate their 75th anniversary this year. Would Troop 600 please stand? Congratulations. Happy 75th anniversary. The chair gives permission to the local government committee to continue to meet. Please take your seats. Also in the gallery, our colleagues that collectively serve Philadelphia County and specifically South Philadelphia, Representatives Fiedler, Harris, and Young, have the South Philadelphia High School Sunrise After School program. Since 1999, the Sunrise of Philadelphia has helped students realize strengths, discover successes, and prepare for their futures. They will unite dozens of students from across Pennsylvania to advocate for high-quality after-school and out-of-school time program, and the chair was pleased to visit them at South Philly High School just a few months ago with the Appropriations Committee. South Philly Sunrise, please stand. Hope I get to see you much closer today while you're here at the Capitol. Welcome. Our colleague that's right across the river, serves Cumberland County, Representative Delosier, has Ava Green. She's a senior student at the University of Delaware, majoring in political science and doing a legislative internship this summer in the office of Representative Delosier. Ava, please stand. Thank you in advance for all your hard work this summer. Our colleague that serves Butler County, Representative Shalaba, has Isaiah Clerkley. Isaiah is visiting the Capitol this morning with his coaches, Nancy Loslovic and Michael Kakamo. Isaiah is being honored because he won first place in the 1-meter diving event at the PIAA State Swimming and Diving Championships. And the biggest news for Isaiah with all of his wins, he was just able to qualify for the international meet in Rome this July. We wish you well, Isaiah. Would you and your coaches please stand? Congratulations. Some more guests have arrived to the gallery. We're so excited that our colleague, Representative Stan Ball, who serves Juniata County, has brought Matthew Kirchhoff, a fourth grader from his district who is interested in the state government and is here to watch us work. Matthew, please stand. We're so excited you're here today. Also in the gallery, our colleague that serves Luzerne County, Representative Rinkavage, has brought students from the Daniel Flood Elementary School Student Council. They traveled to Harrisburg to learn about government. Daniel Flood Elementary students, please stand. Two of our colleagues have a joint guest today. Representative Dawkins and Representative Jones have brought Sonia Benjamin. She's here to visit and watch session. Her daughter is a research analyst in the Labor and Industry Committee, which Representative Dawkins chairs, and she lives in Representative Jones's district. Sonia, please stand. We're so excited to welcome you on the floor of the House. Thank you for your hard work here. We have some distinguished guests from Philadelphia County that just came into the back of the house. Representative Isaacson has brought the fourth graders from St. Mary's Interparochial School to visit the Capitol today. St. Mary's fourth graders, come on and stand up so we can welcome you. The House will come to order. Colleagues, please take your seats. We have two very important guests that we want to properly acknowledge. Listen about these brave heroes among us. Please take your seats, colleagues. This morning, it is with incredible honor and humility that for the first time on the floor of this House, we are so thrilled to welcome former United States Capitol Police Sergeant Aquino Gonell and former United States Capitol Police Officer Harry Dunn. Both of these men were present, physically and verbally attacked, but bravely defended democracy and the United States Capitol against rioters and insurrections on January the 6th, 2021. They are traveling the nation and sharing their stories to raise awareness to the threats of democracy in our nation. Sergeant Gonell and Officer Dunn, please stand. Welcome to the floor of the House. The chair grants brief permission for Florent Muller and Frederick Capron to take photographs and video of our distinguished guests, former United States Capitol Police Sergeant Akuno Gonell and former United States Capitol Police Officer Harry Dunn, for the next 10 minutes. Are there requests for leaves of absence? The chair recognizes the majority whip, who indicates there are none. The chair recognizes the minority whip, who indicates there are none. The chair is about to take the master roll call. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the master roll call. 202 members have been voted. A quorum is present. Chair referred the following bills, which the clerk will now read.
Referrals, June 4th, 2024. House Bill 2377, Children and Youth, Senate Bill 1104, Education. House Bill 2374, House Resolution 464, and Senate Bill 1102, all three to Health. House Bill 2379, Insurance. House Bill 2381, Professional Licensure. House Bill 2380, State Government. House Bill 2375 and House Bill 2376, both to Transportation. Referrals, June 5th, 2024. House Bill 2383, Aging and Older Adult Services. House Bill 2384, Environmental Resources and Energy. And House Bill 2382 to Health.
Chair recognizes Representative Daly, Chair of the Committee on Tourism and Economic and Recreational Development, who reports the following bill. House Bill 1819, reported as committed. Will the House agree to the bill? It's agreed to. Chair recognizes Representative Daly, Chair of the Committee on Tourism and Economic and Recreational Development, who reports the following resolutions. H.R. 452, reported as committed. Will the House agree to the report? It's agreed to. H.R. 460, reported as committed. Will the House agree the report? It is agreed to. H.R. 461, reported as committed. Will the House agree the report? It's agreed to. H.R. 462, reported as committed. Will the House agree the report? It's agreed to. H.R. 463, reported as committed. Will the House agree the report? It's agreed to. Chair recognizes Representative Frankel, Chair of the Committee on Health, who reports the following bill. House Bill 2283, reported as amended. Will the House agree the bill is agreed to? Chair recognizes Representative Frankel, Chair of the Committee on Health, who reports the following resolution. H.R. 446, reported as committed. Will the House agree the report is agreed to? Chair recognizes Representative Dawkins, Chair of the Committee on Labor and Industry, who reports the following bill. Senate Bill 1109, reported as amended. Will the House agree the bill is agreed to? Chair recognizes Representative Dawkins, Chair of the Committee on Labor and Industry, who reports the following resolutions. H.R. 407, reported as committed. Will the House agree the report is agreed to? H.R. 436, reported as committed. Will the House agree the report it is agreed to? Chair is in receipt of extracts from the Journal of the Senate, which the clerk will now read.
Bills number and titles as follows, having been prepared for presentation to the governor, and the same being correct. The titles were publicly read as follows: Senate Bill 497 and Senate Bill 1018. Whereupon the Speaker, in the presence of the House, signed the same.
Chair is about to sign the following bills, which the clerk will now read.
Senate Bill 497 and Senate Bill 1018.
Chair recognizes the Majority Caucus Chair, Representative Schlossberg, for a caucus announcement.
Thank you, Madam Speaker. There will be an immediate meeting of the House Rules Committee in the Majority Caucus Room. House Democrats will caucus at 1. We will be prepared to return to the floor at 2.
Chair thanks the gentleman. Chair recognizes the gentleman, Representative Dunbar, for a caucus announcement.
Thank you, Madam Speaker. Republicans will caucus at 12:30. Republicans will caucus at 12:30. Thank you, Madam Speaker.
Chair thanks the gentleman. Chair recognizes the gentleman from Philadelphia County for a committee announcement. Majority Chair of Appropriations, Representative Harris.
Thank you, Madam Speaker. Madam Speaker, the House Appropriations Committee will meet immediately following the Rules Committee in the Majority Caucus Room. House Appropriations Committee meeting in the Majority Caucus Room. Thank you, Madam Speaker.
Chair thanks the gentleman. For what purpose does the gentleman from Allegheny County, Representative McAndrew, rise?
Point of personal privilege, Madam Speaker.
The gentleman is in order and may proceed.
I just want to take the time to wish my wife a happy 35th birthday. She is the mother of 3 daughters, married 7 years, and turns 35 today. Happy birthday, Michelle McAndrew.
If she's still watching, happy birthday, Mrs. McAndrew. House will stand in recess until 2:00 p.m. Chair recognizes the gentleman from Luzerne, Representative Eddie Day Pashinsky.
Thank you very much, Madam Speaker. Just a reminder, we're taking our second seersucker photo at noon on the steps in the main rotunda. Thank you so very much. And the clothes drive, Dress for Success, was an absolute success. Thank you for all your support. You're helping a lot of folks, believe me. Thank you. Thank you, Madam Speaker.
Chair thanks the gentleman. The House will stand in recess until 2:00 p.m. unless sooner recalled by the Speaker. Time of 2:30 having arrived, the House will come to order. Members, please take your seats. Chairs in receipt of an actuarial note from the Independent Fiscal Office regarding the following, which the clerk will now read.
Senate Bill 464, Penders number 449, as amended by Amendment A03991.
Chair recognizes Representative Bradford, Chair of the Committee on Rules, who reports the following bill. House Bill 27370, re-reported as committee. Will the House agree to the report? It's agreed to. Chair recognizes Representative Bullock, Chair of the Committee on Children and Youth, who reports the following bills. House Bill 350, reported as amended. Will the House agree to the bill? It's agreed to. House Bill 2037, reported as amended. Will the House agree to the bill? It is agreed to. Chair recognizes Representative Harris, Chair of the Committee on Appropriations, who reports the following bills. House Bill 1839, re-reported as committed. Will the House agree to the report? It's agreed to. House Bill 2137, re-reported as committed. Will the House agree to the report? It's agreed to. House Bill 2234, re-reported as committed. Will the House agree to the report? It's agreed to. House Bill 2235, re-reported as committed. Will the House agree to the report? It's agreed to. Senate Bill 126, re-reported as committed. Will the House agree to the report? It's agreed to. Senate Bill 943, re-reported as committed. Will the House agree to the report? It is agreed to. Chair referred the following bills, which the clerk will now read.
Referrals, June 5th, 2024. House Bill 2400, House Resolution 469, both to Aging and Older Adult Services. House Bill 2387 to Commerce. House Bill 2386 Education. House Resolution 468, Environmental Resources and Energy. House Bill 2388, Senate Bill 742, Senate Bill 1051, Senate Bill 1149, all those to Finance. House Resolution 467, Housing and Community Development. House Bill 2385, Insurance. Senate Bill 1173 to Professional Licensure.
Chairs in receipt of extracts from the Journal of the Senate, which the clerk will now read.
Clerk of the Senate being introduced, return bill from the House of Representatives, numbered and titled as follows. House Bill 1246. With the information the Senate has passed the same without amendment. Bills numbered and titled as follows, having been prepared for presentation to the governor and the same being correct, the titles were publicly read as follows. House Bill 1246, whereupon the Speaker, in the presence of the House, signed the same.
Chair is about to sign the following bill, which the clerk will now read.
House Bill 1246.
Chair recognizes Representative Freeman, Chair of the Committee on Local Government, who reports the following bills. House Bill 1423, reported as committed. Will the House agree? The bill is agreed to. House Bill 1976, reported as amended. Will the House agree? The bill is agreed to. House Bill 2045, reported as committed. Will the House agree to the bill? It's agreed to. House Bill 2265, reported as committed. Will the House agree to the bill? It's agreed to. The chair recognizes Representative Freeman, Chair of the Committee on Local Government, who reports the following resolution. H.R. 449, reported as committed. Will the House agree to the report? It is agreed to. Chair recognizes the Majority Leader, who calls up House Resolution 429, printers number 3073 on page 6 of today's House calendar. Clerk will read a summary of the resolution.
A resolution designating the week of June 2nd through June 8th, 2024 as Chesapeake Bay Awareness Week in Pennsylvania, introduced by Representative Sturla.
Will the House agree to the resolution? Those in favor of the resolution will be voting aye. Those opposed will be voting no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the resolution. The ayes are 199, the nays are 3. The resolution is adopted. Chair recognizes the Majority Leader who calls up House Resolution 442, printers number 3116, on page 6 of today's House calendar. Clerk will read a summary of the resolution.
A resolution designating June 4th, 2024 as Links Day in Pennsylvania, introduced by Representative Morgan Cephas.
Will the House agree to the resolution? On that question, Chair recognizes the maker of the resolution, the gentlelady from Philadelphia County, Representative Cephas.
Thank you, Madam Speaker and colleagues, for the opportunity to speak today on House Resolution 442, which designates June 4th, 2024 as Links Day in the Pennsylvania Capitol, which is the first day that the members of the Links Incorporated spent some time in Harrisburg to lobby for issues amongst their legislators and stakeholders that are critical to the communities that they represent. On November 9th, 1946 in Philadelphia, two visionary leaders, Sarah Strickland Scott and Margaret Hawkins, co-founded the Links Incorporated, which is an organization that envisioned responding to the needs and aspirations of Black women in ways that existing clubs did not. It was their intent that the club would have a threefold mission: civics, educational, and cultural. Since the founding, the Links Incorporated has become an international nonprofit corporation focused on ensuring the culture and economic survival of African Americans and other people of African descent. Additionally, since its founding, the Links Incorporated have contributed more than 950,000 documented hours of community service, representing 18,000 members across 300+ chapters located in 42 states, the District of Columbia, the Commonwealth of the Bahamas, and the United Kingdom, and including 7 chapters in Pennsylvania. Those 7 chapters include the Bucks County chapter, the Delaware Valley chapter, the Harrisburg chapter, the Montgomery County chapter, the Pentown chapter, the Philadelphia chapter, again, which is the founding chapter, and the Pittsburgh chapter. All links from across the Commonwealth of Pennsylvania were here over the past 2 days, Monday and Tuesday, to advocate for both the Crown Act and the Pennsylvania Omnibus legislative package. So for those reasons, I am urging my colleagues to vote for House Resolution 442 in honoring the Links Incorporated for their first day at the state's Capitol. Thank you, Madam Speaker.
Chair thanks the gentlelady. Those in favor of the resolution will be voting aye. Those opposed will be voting no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the resolution. The ayes are 198. The nays are 4. The resolution is adopted. Colleagues, if I can have your attention, the House will come to order. We do have an afternoon guest to acknowledge. The House will come to order. This afternoon, our colleague that serves Montgomery County and is the chair of the Pennsylvania Legislative Black Caucus, Representative Nelson, has brought all the way from Georgia a colleague of ours from the Georgia Assembly. We are excited to welcome State Representative Teddy Reese, who serves the 140th Legislative District. He is the chairman of the Youth Advocacy Program. That program has its origins here in Harrisburg. He works very hard and focusing, the House will come to order. Members, take your seats. Sergeants, clear the aisles. Please take your conversations off of the floor of the House if you must talk at this time. Please take your seats or take your conversations off of the floor of the House. This afternoon, our colleague that serves Montgomery County and is the chair of the Pennsylvania Legislative Black Caucus, Representative Nelson, has brought a colleague all the way from Georgia. He is State Representative Teddy Reese. He serves his constituents in the 140th Legislative District. He is the chairman of the Youth Advocacy Program, which has its origins here in Harrisburg. He works every day to fight and provide violence intervention. He was born and raised in Gordon, Georgia. He became the first in his family to attend any higher education. He currently lives and serves his constituents in Columbus, Georgia, where he works very closely with the local community and grassroots projects. He's a lifetime member of Alpha Phi Alpha fraternity. He is a part of the Albany State National Alumni Association. He has served as chair of the Black History Month Observance Breakfast Committee. He graduated from Albany with a bachelor's in computer science. He then got a master's degree from Georgia College in Middleville, 2005, and in 2012, he graduated with distinct honors from Florida A&M University College of Law. Representative Reese, my colleagues and I are so grateful to have you and welcome you here to the hall of the Pennsylvania House of Representatives, the longest continuous legislative body in our nation. Welcome.
The chair recognizes the majority leader who calls up House Bill 1754, printers number 3198 on page 3 of today's House calendar. The clerk will read a summary of the bill.
This bill requires health insurance policies and government programs to provide coverage of biomarker testing.
Will the House agree to the bill? Agreed to. The chair recognizes the majority leader who calls up House Bill 2370, printers number 3196 on page 1 of supplemental calendar A. The clerk will read a summary of the bill.
This bill contains basic education funding formulas.
Will the House agree to the bill? The chair is in receipt of a demand pursuant to House Rule 66 from Representative Schweier and Representative Sturla to take the yeas and nays via the electronic roll call system. On the question of whether the House will agree to House Bill 2370 for the second time, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the question, the yeas are 104, the nays are 98. A majority having voted in the affirmative, the bill is agreed to. The chair recognizes the majority leader who calls up House Bill 1021, printers number 3053 on page 2 of today's House calendar. The clerk will read a summary of the bill.
This bill prohibits life insurers from discriminating against an applicant or enrollee who obtained an opioid overdose reversal agent such as naloxone.
Will the House agree to the bill? The chair rules the following amendment out of order for violating House Rule 20, A04484. Will the House agree to the bill? Agreed to. The chair recognizes the majority leader who calls up House Bill 2127, printers number 3148 on page 2 of today's House calendar. The clerk will read a summary of the bill.
This bill requires health facilities and providers treating patients related to pregnancy to screen and educate on perinatal depression.
Will the House agree to the bill? Representative Rapp offers Amendment 04651. Will the House agree to the amendment? On that question, the chair recognizes the gentlelady from Warren County, Representative Rapp.
Thank you, Mr. Speaker. Mr. Speaker, first I'd like to thank the prime sponsor of the underlying bill for listening to my concerns and others on the committee that were expressed in the committee and for being willing to address them. I appreciate her dedication to this important issue. My amendment 4651 removes the postpartum mood and anxiety disorder information distribution requirements and instead gives providers the option to hand out educational and resource information to their perinatal and postpartum patients. In addition, this amendment makes various technical corrections to ensure the language consistency throughout the bill. In my opinion, it's not necessary to overburden practitioners with additional mandates when screening for postpartum depression, when it's already part of best practice for many provider groups. However, making information about postpartum mood and anxiety disorders accessible is an important step towards supporting maternal mental health. That is why my amendment preserves the development of educational materials and a public awareness campaign. Again, I'd like to thank the prime sponsor for working with me to come to an agreement on this amendment, and I would ask my colleagues for their support. And thank you, Mr. Speaker.
Chair thanks the gentlelady. Chair recognizes the gentlelady from Philadelphia County, Representative Fiedler.
Thank you, Mr. Speaker. Postpartum depression is the most common complication for a person who has just had a baby. The most common complication. Providing support and information about it for new moms is critical to helping them and their babies. I want to thank Chair Rapp for offering this amendment, for her conversations on this important issue. I also want to thank the March of Dimes, the Maternity Care Coalition, the Pennsylvania Association of Certified Nurse Midwives for their incredible assistance over the past few months and for their support of the bill. I would like to thank the Black Maternal Health Caucus and my co-primes, Rep. Curry and Rep. Borowski, for their insight and dedication. And I would like to thank ACOG and the PA chapter.
The gentlelady will suspend. Members, gentlelady has the right to be heard.
Thank you.
Thank you. Gentlelady may proceed.
And finally, I would like to thank ACOG and the PA chapter of the American Academy of Pediatrics for your ongoing conversations on this issue and your support of this amendment. We have more work to do. Again, I would like to thank Chair Frankel, Chair Rapp, and their staffs. This is an agreed to amendment, and I ask the members for your support. Thank you.
Chair thanks the gentlelady. Those in favor of the amendment will vote aye. Those opposed, no. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote. On the amendment, the ayes are 202, the nays are 0. The amendment is agreed to. Will the House agree to the bill? Agreed to. The bill as amended will be reprinted. The chair recognizes the majority leader who calls up House Bill 2354, printers number 3197 on page 1 of today's House calendar. The clerk will read a summary of the bill.
This bill eliminates the requirement for an interstate CVI to board out-of-state dogs in Pennsylvania.
It is the chair's understanding that the gentleman from Erie, Representative Bizzarro, has withdrawn all of his amendments. Chair thanks the gentleman. Will the House agree to the bill? Agreed to. The chair recognizes the majority leader who calls up House Bill 1839, printers number 2280, on page 2 of supplemental calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill amends Title 71 to provide extension of temporary regulations.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? Agreeable to the provisions of the Constitution, the yeas and the nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the final passage of the bill. The yeas are 102, the nays are 100. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate for concurrence. The chair recognizes the majority leader who calls up House Bill 2137, printers number 3230, on page 1 of supplemental calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill establishes a maternal and newborn end supply kit program under the Department of Health.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? On the question, the chair recognizes the gentlelady from Allegheny County, Representative Mays.
Mr. Speaker, in our effort to address social determinants of health that impact maternal health outcomes, House Bill 2137, introduced by Rep. Curry and I, establishes a program to help ease the financial and emotional stress faced by new parents and new moms and new parents, providing them with maternal and newborn supplies. And in these maternal and newborn supply kits, we would also be connecting them to additional support programs available at the state and county levels. House Bill 2137 is one of our 8 great bills in the Pennsylvania Momnibus, introduced by the Pennsylvania Black Maternal Health Caucus to address the needs of moms and babies who need support. About 17% of children are living in poverty in our Commonwealth. And if we were to extrapolate this data, then we have about 17% of babies born into poverty. I mentioned social determinants of health, which is a public health concept that considers factors in your life that impact your health, which may include, but is not limited to, your income, your gender, your race, or zip code, that all play a role in determining your health outcomes. Not having what you need for your new baby is unconscionable. Whether you live in 15206 in Allegheny County, where I'm from, or whether you live in 19139, where I grew up in Philadelphia, or whether you live in Cameron, Crawford, Forest, Juniata, and Sullivan counties, which are maternal health deserts. If you're pregnant and impoverished, or if you have had a baby, it is very likely that that mom will not have the basic necessities to take care of their own physical postpartum needs or to care for their baby when they leave the hospital. House Bill 2137 is part of an answer to a broader systemic issue concerning social determinants of health and maternal mortality and morbidity, which could mean life or death or determine how sick a person may be before, during, or after childbirth. These maternal and newborn supply kits, or welcome baby kits, are not just to provide the supplies alone. It is to ensure that a new parent is connected to state resources, as well as what's available to them in their community. I look forward to working with county governments who have implemented programs like this, like Hello Baby in Allegheny County, who are already doing the work, as well as filling the gaps in counties where there are no resources, which means that a pregnant person might not even have a place to give birth or a doctor who can deliver their baby. My bill is based off of a federal pilot that is operating in Arkansas, Louisiana, and New Mexico. And this is an opportunity to position Pennsylvania as one of the greatest advocates for maternal mortality and morbidity. The Pennsylvania Momnibus will change lives and save lives. And so I ask for all of you, once again, to get on the bus and vote this important bill, House Bill 2137, out of our chamber. I also like to take a moment to thank Chair Kinsey and the Human Services Committee, staff, as well as Secretary Dr. Bogan and the Department of Health for your diligent work to advance Black maternal health in the Commonwealth of Pennsylvania. Thank you, Mr. Speaker.
Chair thanks the gentlelady. On the question, the chair recognizes the gentlelady from York County, Representative Klunk.
Thank you, Mr. Speaker. Will the maker of the bill stand for interrogation?
The gentlelady declines.
Thank you, Mr. Speaker. I'm sorry that the gentlelady declined because I do have some questions, but I will bring them up in my remarks instead. I stand before you as a mom. I support moms because I am one. I'm a mother to 2 young little girls, and I have stood here at this very same podium and had both of them in my womb. I've delivered 2 children, 1 with a C-section and 1 vaginally. And as I look through this bill, I want to support moms, but I also have some concerns. Number 1, this bill is modeled after a federal pilot program. HHS is neither involved in the fundraising for Baby to Baby, nor the procurement and distribution process for these newborn supply kits that are done at the federal level. Additionally, there is no federal funding that goes to this pilot program. The bill before us today would insert state dollars into this program. And what I believe, and I have some questions about this that unfortunately won't be answered because the maker won't stand for interrogation, but as I worked through the bill itself, I had some serious concerns. So under the bill, the newborn baby kits can be distributed up until 12 months after delivery of a baby. The postpartum care kit can be distributed up to 6 weeks after the delivery of the baby. I'm not sure exactly where those particular time frames came from. So when I look through the bill itself, a number of the items that are listed under the maternal and newborn supply kit contents are items that I personally received in the hospital that were paid for under my insurance. One of my concerns about this bill is that we will be paying for some of these items twice. Okay? Twice. We could potentially be giving moms perineal ice packs twice, perineal wash twice, and we could potentially be giving peri bottles, which for those of you out there that don't know what a peri bottle is, because I know, some of the men in the room here might not know what they are. They're what you use to clean yourself when you have a tear, like I did during my first birth. I received one of those bottles when I gave birth to my daughter Grace in the hospital. And what I'll tell you, Mr. Speaker, is that you really don't need 2 of them. You just need 1, okay? One that was provided to me at the hospital. After 6 weeks, I probably would not need an additional perineal wash or the peri bottle, okay? As I go down through here, again, a number of these items were sent home. And my concern is that based on the language, it says must contain the following items. Well, what about the C-section, Mr. Speaker? So my first birth with Grace was a vaginal delivery. My second birth with Claire was a C-section. You don't need perineal wash, a peri bottle, because you don't have a tear with the C-section, typically, unless you tried maybe vaginally and then they needed to do an emergency C-section. So we could potentially be wasting dollars in sending out these kits in duplicative items that moms likely already received in the hospital or, quite frankly, don't need because they didn't actually have that particular type of delivery. Another item on the list are nursing pads. There's nothing in the description, Mr. Speaker, that discusses whether or not they will be washable pads or if they will be disposable pads. Disposable pads are not good for the environment and could be discarded. Washable ones, well, I will tell you probably aren't quite as good from my personal opinion, personal experience. They are much better for the environment. And let me remind you that those items are up until 6 weeks. And typically after the 6-week mark, you really, again, don't need many of these items. You may need the nipple cream, okay? You might need the nipple cream, I know that. I used the nipple cream for a while. Now, when you move into the newborn care kit, one of the items is a thermometer. It's not specific what type of thermometer this kit has to provide. Again, if we're providing state funding, are we giving them the top of the line, thermometer, where you go across the head, you stick it in the ear, and on my house, we bought the $10 one that's oral and rectal. I don't know, because there's a big difference in the cost, okay? There's a nasal aspirator. We got one of those when we were sent home with both girls. We actually have 2 of them at home right now. And again, as I go through the list here, I'm just not sure why some of these items are on the list. And there's confusion as to how many. How many diapers? How many wipes? How many onesies? What size shampoo? Are we going to be giving out sample bottles, or are we going to be giving out big, huge bottles? Are we going to be giving out sample bottles of lotion or big bottles of lotion? We don't know, and the cost of that is undetermined. Mr. Speaker, I want to support our moms here in Pennsylvania. I really do, because I am one. I went through this. And you know what? Under this bill, a mom like me who stands here as a state representative who's fully capable of going out, thankfully, and buying these supplies could receive one of these kits. And quite frankly, Mr. Speaker, there are women like me and the women who can give birth in this room who could get these kits, and there are other moms in Pennsylvania who would need them more. Mr. Speaker, this bill is not targeted to the moms who need it the most. And as the previous speaker talked about, there are moms in this Commonwealth who may need some of these supplies. But this bill doesn't help target them. We can and should be doing better with this bill. We should be standing for our taxpayers and not making duplicative purchases for our moms, but we should also be targeting and helping those moms who need it the most. And for those reasons, I will be a no. I do appreciate the maker and what she's trying to do in helping support our moms, but I just don't believe that this bill does what we need it to do here in Pennsylvania, and it needs some work. Thank you.
Chair thanks the gentlelady. On the question, the chair recognizes the gentlelady from Delaware County, Representative Curry.
Thank you, Mr. Speaker. I appreciate Representative Klunk's opinion about what this bill is about. But I would caution when we start to use numbers of diapers and water bottles to heal tears and all of the things that Representative Klunk made notice of. I would caution—
Gentlelady will suspend. As a quick reminder to the gentlelady, you can't use— Thank you very much. As a reminder to the members, we do not use the names of members during the course of debate. The gentlelady is in order and may continue.
Thank you, Mr. Speaker. The gentlelady from York. I would remind everybody in this body that when the PA Black Maternal Health Caucus was formed, that we were looking at the mortality and morbidity rates of women in Pennsylvania. In doing that, this bill, 2137, is a part of the 8 great bills that we are bringing forward to care for mothers and babies in this Commonwealth. If the body would look at the actual bill, we worked very hard with the Department of Health to put together a sensible bill that is not like the federal program, but it is our very own here in Pennsylvania for mothers to be able to request these kits in their birthing experience. It is very important that we continue to focus on the needs of our mothers and babies in this Commonwealth, as we have done throughout this journey of the Momnibus. And I'm just going to remind us that we have 107 that were identified in death. We have to do better, and that's what we are trying to do with House Bill 2137. Thank you, Mr. Speaker.
Chair thanks the gentlelady. On the question, the chair recognizes the gentlelady from Allegheny County, Representative Gatos.
Thank you, Mr. Speaker. The previous speaker said we do have to do better. I commend the maker of the bill for wanting to and working so hard to reduce the maternal and infant mortality and to improve health outcomes. It's something that I have been focusing on in my entire time here in the State House. But this bill has no income limits. These items should not go to the wealthy. There are plenty of Commonwealth programs that already fund these items, and this bill is just not ready for prime time. This bill duplicates programs and expenses already in existence when funding should go to those needy, those who are needy, not to those who are wealthy. Thank you. I will oppose this bill.
Chair thanks the gentlelady. On the question, the chair recognizes the gentleman from Delaware County, Representative Williams.
Thank you, Mr. Speaker. I sat in my seat in the second row right on the aisle that separates left from right. Try to listen very critically to the arguments of both sides. And today, what I'm hearing is an argument about being a penny wise and a pound foolish. What do I mean by that? We're going to measure the number of diapers that are in a kit. We're going to measure the number of pacifiers that are in a kit, the amount of formula that's in a kit. We're going to do an assessment of whether or not a family is actually in need before we help them in those critical first hours of care. I ran into a case when I was in the military as a prosecutor where a couple allowed a child to exsanguinate from a circumcision wound. For those of you that don't know, exsanguination is bleeding to death because they didn't have enough diapers to care for him. They didn't have enough Vaseline to care for him, and they didn't tell anybody. I personally am not in the business of going family to family in my district to find out who's in need. I would far more prefer to hand them a maternal care kit on the day that their child is born and give them a first step the day that they walk from a hospital. I am not in the business sitting on a $14 billion surplus in our budget of trying to save $500,000. Today, I'm going to ask you, please, to not do an evaluation of your district's 63,000 people and try to determine what are the 5,000 people who need our assistance today, and please vote yes on House Bill 2137.
Chair recognizes the sponsor of the legislation, Representative Mays, for the second time.
Mr. Speaker, I'm a mom too. I know full well from my own lived experience what is needed or what may be needed for a mom or her baby. So I ask for your vote on House Bill 2137. As co-chair of the Black Maternal Health Caucus, who actually has the courage and actually has the vision to end maternal morbidity for all moms, because we are leaving no mom behind, I ask for your vote on House Bill 2137. And as a human being, we should not leave any mom out, especially in the most precious and critical time in their pregnancy and birth journey. And so we should always be meeting the needs of moms in the Commonwealth of Pennsylvania. So I ask for a yes on House Bill 2137, and that's all I'm going to say.
The chair thanks the gentlelady for the information of the members. It is tradition of the House that the leaders and prime sponsor are given final opportunity to speak. It is the preference of the speaker and the chair that that is how debate proceeds. However, we have one additional light. The chair recognizes the gentleman from Carbon County, Representative Heffley.
Thank you, Mr. Speaker. I actually had to walk to the back to push the button or I would have spoke early. I would just say that I believe that everybody here really cares about moms and babies, as I do. I am a grandfather, which is awesome. I have 2 daughters, and I care very deeply for my wife. And as we went through all these childbirths years ago, I was there every step of the way with her. And I think we want to make sure that everybody has what they need to have healthy children. Everybody's for that. But we need to do that in a responsible manner. The pilot program is set up by nonprofits who give to a fund to distribute these kits, and I think we could explore that. But just passing a bill and arbitrarily putting no price tag on it and spending, when we have so many other needs in this Commonwealth. Reimbursement rates for Medicaid are so low in some instances that we need to work on that so our hospitals can stay functioning so we can keep those maternity wards open. So while
Gentleman
I
will
fully
suspend.
support.
As a reminder, the gentleman may stay confined to the topic of this bill and not additional topics. With that in mind, the gentleman is in order and may continue.
I think maternity wards are very important to women's health and to babies' delivery health. So I understand and I respect the intent of this legislation, but the price tag of it and just some of the items that are on there being duplicative, I think there's a lot of work that needs to be done before this is ready to be adopted. And I would really like to much more focus on working with our nonprofits, which already provide many of these services, before we create another taxpayer-funded program that's duplicative. So I will be a no vote on this, but my no vote is not reflective on the fact that I love children and I want to see women be healthy, but it's reflective on how we're spending these dollars. Thank you, Mr. Speaker.
Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 123, the nays are 79. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate for concurrence. The chair recognizes the majority leader who calls up House Bill 2234, printer's number 3056 on page 2 of Supplemental Calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill authorizes the Penny Board of Directors to establish a program to provide Penny customers with additional financial support.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? On the question, the chair recognizes the gentlelady from Dauphin County and the prime sponsor of the bill, Representative Kim.
Thank you, Mr. Speaker. This proposal builds upon the bipartisan work of this General Assembly in creating Penny and the reinsurance program. Penny is where Pennsylvanians can buy health insurance for themselves and their families. Penny and the reinsurance program have been very successful. This past open enrollment period, a record of 435,000 Pennsylvanians bought their health insurance through Penny. But many Pennsylvanians, especially those coming off Medicaid, cannot afford a Penny plan. Many other Pennsylvanians technically have coverage through Penny, but that coverage has a deductible in the thousands of dollars. Let's say you're making $60,000 a year, you got a $10,000 deductible, you're likely not going to the doctor for treatment because your health care costs are too high. Here's an example. Christine is a working mom who went into Penny to buy health insurance, but her policy has a $9,000 deductible and 40% cost sharing. With that high cost sharing, Christine basically cannot use her insurance for anything other than preventative and emergency care, and her premium still costs her $400 a month. If Christine gets cancer, she would have to pay her $9,000 deductible before her insurance kicks in. People like Christine live in all of our districts, and they shouldn't be denied health care because they can't afford it. House Bill 2234 has two goals in mind. More people get insurance, and more people get better insurance. The bill gives Penny the flexibility to explore creative ways to mitigate high costs and deductibles for about 200,000 to 300,000 Penny customers. And because the bill preserves the reinsurance program, the bill can reduce costs for the 500,000 Pennsylvanians in the individual market. Finally, 57 organizations support this bill. I urge a yes vote on House Bill 2234. Thank you, Mr. Speaker.
Chair thanks the gentlelady. On the question, the chair recognizes the gentleman from Washington County, the Republican whip, Representative O'Neill.
Thank you, Mr. Speaker. Mr. Speaker, on behalf of the gentlelady from Bradford, the minority chair of the Insurance Committee, I submit comments for the record.
Chair thanks the gentleman, and the remarks will be spread upon the record. On the question, the chair recognizes the gentleman from Lancaster County and the Republican leader, Representative Cutler.
Thank you, Mr. Speaker. Mr. Speaker, today I rise in opposition to this proposal. And I'd like to explain a little bit more on the background regarding Penny and the hundreds of thousands of individuals that was outlined by the prime sponsor. That is accurate. This program has worked wonderfully to provide insurance at a lower cost alternative for several years now. In fact, the way the program is designed is we obtained a waiver from the federal government to allow for a reinsurance program which helps to lower overall premiums for everyone on the exchange. I'd like to repeat that, for everyone on the exchange. What this bill does in its current form is fundamentally upsets the balance of the existing program. It potentially jeopardizes the waiver that we have with the federal government. And in addition to that, this is a Band-Aid. It is a one-year fix, a one-year piece of funding, potentially. I spoke yesterday because I offered an alternative on this proposal regarding what exactly moving these funding streams would do. Mr. Speaker, when you look at this proposal, it is somewhat confusing because we're changing the existing program to give the commissioner and the department the authority to move money amongst different funds that are already there, outside of the purview of this General Assembly body, which we typically enter into budget discussions every year and could appropriate an appropriate amount of money to fund such a program, rather than jeopardize the existing program. The Penny program was and remains, I believe, a model achievement for a state-based insurance exchange. It is somewhat unique in the way that it is made up. It was developed under Republican legislative leadership. I myself was the prime sponsor of that original proposal with Leader Dermody, the good Democratic leader from the Allegheny County, in conjunction with a Democratic governor and a Republican federal government administration. Penny remains a celebrated way for Pennsylvanians to get insurance. In fact, every year they are required to issue a report on the actual amount of cost savings that are provided to those individuals who buy insurance on the exchange. Each year during the open enrollment period, legislators and government officials alike from both sides of the aisle encourage enrollment, shopping, and working within the existing exchange to find more affordable and/or better health insurance. And again, while this legislation has a very laudable goal in mind, what it does is rob Peter, or in this case Penny, to pay Paul. without a sustainable or reliable future funding mechanism that ensures long-term success. I do not believe that we should jeopardize an existing program that is performing well for individuals just because the money's available and the governor proposed it in his budget address. I have a great deal of respect for the governor and the goal. I disagree with the method that is being proposed here today. Mr. Speaker, when it comes to Penny, if it's not broke, I don't believe we should try to fix it. We can have honest discussions about supplementing it and how to help those individuals on the lower end of the income band for those people who qualify for the insurance exchange. But let's have a very real discussion of what happens in the event that it jeopardizes our waiver or this funding stream is no longer available. You potentially jeopardize those individuals that are still defined as working class poor, but at the top end of the income range that qualifies them federally. And they could potentially lose insurance, which would shrink the pool, the risk-sharing pool that is used in this, and then ultimately drive up rates inside the exchange for those individuals, or conversely, they'll come to the General Assembly and ask for additional funding. Mr. Speaker, the current program is working. We agree that healthcare should be affordable, accessible, and as the good lady pointed out, the prime sponsor mentioned, access to better insurance. Those are all wonderful goals. Unfortunately, this bill, as it's currently written, I believe jeopardizes each and every one of those. If we want to find ways to lower healthcare costs, both in terms of the cost of delivery and the cost of insurance, let's absolutely have that discussion. Let's talk about tort reform, venue shopping rules, and other cost drivers in the health systems, as well as the rates. We're happy to have that conversation about how to make healthcare more affordable, but what we cannot do is jeopardize an already successful program with an unsustainable subsidy that might sound good as a talking point, but is actually not the best public policy. I urge a no vote.
Chair thanks the gentleman. The chair will again gently remind the members that it is the tradition to allow the members to debate, the prime sponsor, and then the leaders to conclude. That being said, the chair recognizes the prime sponsor, Representative Kim of Dauphin County, for the second time.
Thank you, Mr. Speaker. House Bill 2234 would require that the reinsurance program be adequately funded before ending funding would go to an affordability assistance program. This bill would add an affordability assistance program to incentivize enrollment into Penny and to benefit Penny enrollees. It would not substitute the affordability assistance for the reinsurance program and does not provide either the commissioner or Penny the statutory authority to do so. The bill would require that the reinsurance program have sufficient funding. It would not allow the affordability assistance program to be funded unless the reinsurance program has sufficient funding. The key provision in subparagraph 930552, Penny would be authorized to disperse funds to the affordability assistance program, provided that the reinsurance program has sufficient alternate funding to satisfy the 1332 waiver. Thank you, Mr. Speaker.
Chair thanks the gentlelady. Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on final passage of the bill. The yeas are 106, the nays are 96. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate for concurrence. The chair recognizes the majority leader, who calls up House Bill 2235, printer's number 3240, on page 2 of Supplemental Calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill creates the Meat Processing and Food Packing Protection Act.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? On the question, the chair recognizes the gentleman from Luzerne County and the primary sponsor of the bill, Representative Haddock.
Thank you, Mr. Speaker. House Bill 2235, the Meat Packing and Food Processing Protection Act, will help protect essential workers in this vital and high-risk industry from workplace injury. Workers in the meat packing and food processing industry experience injuries at work, from strains to chemical burns, exposures to hazardous chemicals, lacerations, cuts, up to lacerations. According to OSHA, in the 29 states covered by their standards, 27 meatpacking employees are hospitalized each day in this country for those very injuries. My legislation, House Bill 2235, will help improve the health and safety of the workers in the meatpacking and food processing industry by providing safety training for new workers, supplying workplace policies and signage in language that's easily understood, and creating a workplace health and safety committee. There is a carve-out in this bill that only applies to facilities with 100 or more workers, and it does not apply to grocery stores and other retail food establishments. Meatpacking and food processing for workers are the definition of essential workers and are essential in creating a proper food chain supply for us. These workers deserve common sense protections and to keep them safe at work. And I ask the members for an affirmative vote. Thank you, Mr. Speaker.
Chair thanks the gentleman. On the question, the chair recognizes the gentleman from Westmoreland County, Representative Nelson.
Thank you, Mr. Speaker. I rise to oppose HB 2235 and its unprecedented effort to target and fine food processing and meat packers. This is an essential industry, and I recognize that the prime sponsor from Luzerne and Lackawanna counties has solid intentions. But we have to take a step back and look at the true consequences of this legislation. Just even the scope alone is staggering. Mr. Speaker, by the bill's own description, it ranks Pennsylvania among the states top in the nation for food exports. Tens of thousands of employees and over 2,300 food processors. And when we look at food processors, we have to look at the bill's definition. What employers in each of our districts are about to be ensnared? That is any of the following. As mentioned, meat packing and poultry. And as mentioned, not retail food sales or restaurants. But who else is included? Food establishments subject to inspection by Food Safety Inspection Services. So what does that mean business-wise? That means any manufacturer with a room or a building, 100 employees, used to commercially store, package, make, cook, mix, process, bottle, bake, can, or freeze. What does that mean to our Pennsylvania businesses? That means your beer manufacturers could be included in this. That means Pepsi and Coke products manufacturers could be included. And not just included, but the aspect of massive expanding government. Again, well intended. But instead of incentivizing innovation and worker safety, we are creating a huge hammer. $500 a day penalty on a business, just for the first 10 days. And then that penalty goes to $10,000 a day. So a business who is bottling falls under the area of labor and industry and could be fined $10,000 a day. This bill doesn't even acknowledge or get into how the dispute resolution process works. And each of us should remember that OSHA, federal OSHA standards already apply. Specific standards for meat packers, specific standards for food processors. But what doesn't apply is an endless stream, $10,000 a day fine on the employers in your area. If we look at parallel, what did we do to the energy industry? That Pennsylvania was one of the largest, second largest in the country. And where has it been since excessive government bureaucracy clamped down? 11 canceled plants and products. $10,000 a day fines are going to push our employers out of Pennsylvania. Again, I understand the gentleman's good intentions for worker safety, but we should be incenting innovation, not fining relentlessly. Mr. Speaker, we should all oppose this bill. It's just not ready for prime time. It needs to be defined and constrained so we don't chase more businesses out of Pennsylvania. Thank you, Mr. Speaker.
Chair thanks the gentleman. On the question, the chair recognizes the gentleman from Lehigh County, Representative McKenzie.
Thank you, Mr. Speaker. I think the last speaker was very articulate in defining some of the problems with this legislation. There's another glaring problem with this legislation. In committee, we offered 2 amendments. One that would crack down on the employment of illegal immigrants by major food processors. The second was an amendment to crack down on the employment of child labor in these situations. The majority party voted against each of those amendments and gave a free pass to big business who exploits workers. That is reprehensible. That is absolutely reprehensible. This bill is a pass for big business. That's what this is. It has no penalties, no punishment for big business that exploits workers. So they watered it down to get it through this legislative body, but it does nothing to help protect workers at the end of the day. And that's because they rejected amendments in committee. They should be ashamed of themselves. They are turning their back on workers. They are turning their back on children.
Gentleman will suspend.
They're turning their back on
Gentleman will suspend. The gentleman will suspend. The gentleman may not impugn the motives of members during the course of debate. That in mind, the gentleman may continue. The gentleman may continue.
Was nothing about motives, Mr. Speaker. That was a fact about what happened in committee when the majority party voted against those amendments. That is on the record. You can look at those amendments in committee, you can look at the voting rolls, and you can see who voted against workers and protecting children and illegal immigrants here who are being exploited.
Gentleman,
thank you, Mr. Speaker.
Once again, the gentleman will not impugn the motives of other members, and the speech is concluded. That being said, the chair recognizes the gentlelady from Cumberland County, Representative Gleim.
Thank you, Mr. Speaker. I'm just going to add to the comments of my colleagues and ask my colleagues to vote no on this bill. This bill will increase costs all along the food supply chain. And yet we have no indication exactly of what this legislation will cost, not just to the employers, but also to the state. I mean, we just got a report that is an estimate of over $2 million because new employees are going to be needed at the department level just to implement this. And not only that, but I've received feedback from groups within the industry that they're saying as far as the workers' comp health facility safety committee's portion of this bill, This is already common practice. The workforce compensation laws already provide for certified workplace committees with incentives of a 5% reduction from a workers' comp premium discount, and companies already conduct follow-up evaluations on health and safety equipment procedures. So there are so many reasons to vote no on this bill. It's not ready. I would just encourage all my colleagues to vote no.
Chair thanks the gentlelady. Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the final passage of the bill. The yeas are 120, the nays are 82. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate for concurrence. The chair recognizes the majority leader, who calls up Senate Bill 943, printers number 1121 on page 2 of supplemental calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill modernizes state law on travel insurance.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? Agreeable with the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote on the final passage of the bill. The yeas are 202, the nays are 0. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will return the same to the Senate with the information that the House passed the bill without amendment. The chair recognizes the majority leader, who calls up Senate Bill 126, printers number 1681 on page 1 of supplemental calendar B. Will the House agree to the bill? Agreed to. The clerk will read the title and a brief description of the bill.
This bill excludes veterans' disability benefits from eligibility income for state assistance programs.
The bill has been considered on 3 different days and agreed to. The question is, shall the bill pass finally? Agreeable to the provisions of the Constitution, the yeas and nays will now be taken. Members will proceed to vote. Have all the members voted? Have all the members voted? Clerk will record the vote On final passage of the bill, the yeas are 201, the nays are 1. The majority required by the Constitution having voted in the affirmative, the bill passes finally, and the clerk will present the same to the Senate with the information that the House has passed a bill with amendment in which the concurrence of the Senate is requested. It has come to the chair's attention that there are 2 special birthdays that deserve recognition. Happy birthday to the gentleman from Allegheny County tomorrow, Representative Venkat. And happy birthday to the gentleman from Luzerne County, also tomorrow, Representative Haddock. For the information of the members, there will be no further votes. And before the chair gets killed by his members, it has come to the attention of the chair, thanks to frantic pointing, that today is also the birthday of Representative Green of Philadelphia County. Happy birthday, Representative. Please don't yell at me. Housekeeping. The Majority Leader moves that the following bills be recommitted to the Committee on Appropriations. House Bill 1021, House Bill 1754, House Bill 2127, House Bill 2354, House Bill 2370. The Majority Leader moves that the following bills be removed from the tabled calendar and placed on the active calendar. House Bill 1783, House Bill 2182, House Bill 2196, House Bill 2309, House Bill 2310. The House will come to order. Members are asked to please take their seats or clear the aisle so we can proceed with Rule 17 speeches. The chair is about to recognize Representative Gatos pursuant to House Rule 17, who will be making remarks regarding EMS Week, Rescue Dog Day, and D-Day. On the Rule 17 speech, the chair recognizes the gentlelady from Allegheny County, Representative Gatos.
Thank you, Mr. Speaker. I rise in support of designating the week of May 19th through the 25th as Emergency Services, Medical Services Week in Pennsylvania. As someone who has had the honor of serving as an EMS professional, I understand the dedication, courage, and expertise that the men and women in this field bring to their communities every single day. Emergency medical services are a critical component of our public health and safety systems, providing life-saving care in times of urgent need. The theme for this year's EMS Week is caring for our communities. Our communities are essential. It captures what EMS professionals do. They are our community. They are often the first on the scene during emergencies, offering immediate care and compassion to those in distress. Their swift actions, knowledge, and skills make a difference in outcomes for patients. Having been an EMT myself in my younger days, I personally appreciate all that EMTs do. Pennsylvania EMS personnel work tirelessly, often under challenging and stressful circumstances, and they ensure that every citizen receives the best possible care during emergencies. Their commitment to continuous training and improvement ensures that they are always ready to respond in crisis. Emergency Services Medical Services Week is an opportunity for all of us to recognize and celebrate their contributions and to honor their sacrifices and to thank them for all their dedication to saving lives and protecting their communities. I would also be remiss if I did not extend the appreciation to all the families of EMS workers who also support them and are part of our community, and they also share in the challenges of their demanding roles. So please, let's support them, not only this week, but throughout the year, ensuring that they have the resources and the recognition they deserve. Thank you, all EMS providers. Thank you, Mr. Speaker.
The chair thanks the gentlelady. Seeing no further recognition for Rule 17 speeches, the chair is in receipt of a motion by the gentleman from Cambria County, Representative Burns, that the House now adjourn until Monday, June 10th, 2024 at 12 o'clock noon, unless sooner recalled by the Speaker. The question is on the motion. Those in favor say aye. Those opposed, no. The ayes have it, and the House stands adjourned until Monday, June 10th, 2024 at 12 o'clock noon, unless sooner recalled by the Speaker.